Hi everybody, so my name is Chris and I'm the Deputy Head of Paediatric Clinics, and we're here today at the SHAWCO Kensington site. So we're here today doing a mom and baby clinic, which is where we see moms and babies together. It's a collaboration between the women's health portfolio and the pediatric portfolio, where we're going to be seeing women for any gynecological issues, any general health issues, as well as children for any general health issues. So today is really cool. We've just printed and distributed our new Peds Dermatology 101 book. It's basically got a whole bunch of information on common pediatric skin conditions that we tend to encounter at the SHAWCO clinics. Often it is very difficult for students to identify them and know what correct questions to ask about the skin conditions. So we thought that this would be a really good idea to just help the students out and even help the doctors out when necessary. Saturday of a typical mom and baby clinic, students will arrive at the SHAWCO College on UCT Faculty of Health Science at about 8 o'clock, so that we can hopefully drive out to our various sites by about 8:15 and arrive at around 8:30. The students are then going to separate into their various groups. So we're going to have a group of students who are part of our health promotion team doing health promotion to the parents and children who are waiting. The topics span a range of different topics, such as dental health all the way to women's mental health. So it's really a broad range over there. Going to have the health and rehab students go to their various sites, as well as the medical students are then going to go to our amazing mobile clinics, which are behind me. On the day, from what I can talk about my experience as a medical student, the students are going to pair up, where there's going to be a pre-clinical year together with a clinical year, where they're going to be able to see a patient alone, which is very cool. They're going to be able to take a history and examine the patient to the extent that they're able to, before the doctor will then round and make sure that the student has done everything correctly, where the doctor will diagnose and prescribe the correct medication. So in terms of the timing of that, the doctor is going to arrive at about 10 o'clock and start seeing the patients together with the students, and then hopefully by about 2 o'clock all of the patients have been seen by health and rehab and by the medical students, so that we can pack everything up and be back on campus by 3 o'clock and everybody can go about their day. It's better when she's resting.
My name is Lisombe. I am studying medicine and I'm in my second year. We are at Kensington. My favorite part about pediatric clinics is the vulnerability of children and having them entrust you with their life and the fact that you will contribute to their well-being.
So my favorite part about the SHAWCO Mom and Baby Clinics is seeing the smiles on the kids' faces when we arrive, being able to play with them, giving them toys, getting them to draw, really brings a smile to my face. I also really love reassuring the moms and seeing how happy they get when we reassure them that the kid is going to be okay and that we can help them with their health problems. Furthermore, I also love coming here to learn. We have amazing collaborations with the health and rehab students. Today we have audiologists, speech language pathologists, and occupational therapists with us. We also obviously have our amazing volunteer doctors who come and teach us and help us learn outside of the university space. And furthermore, we also get to collaborate with students in different years, 5th years, 6th years. As a pre-clinical year, it's incredibly helpful to learn from them and their experience. So the whole experience is really awesome.